Okay, welcome guys. In this session, we will be discussing about an individual protein that is collagen. What is collagen? What is the use of collagen? How the collagen is synthesized, and what are the various collagen disorders that we have? So, starting with the basic thing is the basic point that we can add here is the collagen is the most common protein of body. Most common protein of body. Collagen is there in all the structure. You name any structure, the collagen is there. Skin, ligament, tendon, muscle, bone, cornea, hairs, nails, everywhere is collagen. Everywhere is collagen. So I can say it is present in all the tissue. Present in all tissue. It is the major structural protein. Means most of the structure in the body is made up of collagen, major structural protein. The highest concentration of collagen is found in skin. Highest concentration is found in skin, followed by cornea. So the highest amount of collagen is found in skin. These are the basic points to be remembered for collagen. It's the most common protein, is the major structural protein, is found in all this tissue, and the maximum concentration is there in the skin. Now, once we have understood this point, let's see the types of collagen. Let's see the types of collagen. When it comes to the types of collagen, again the list is very long. Around 20 types of collagen we have. We do not have to remember the entire list. We'll just write down the important ones, that which collagen is found where. So starting with the first one, the collagen type 1. Collagen type 1, it is found in bone. Type 1 is found in bone, skin, ligament, tendon. Collagen type 2, it is found in cartilage. Type 3, it is found in the major blood vessels such as aorta. Type 4, it is found in the basement membrane. The basement membrane which is there in the kidney, there in the alveoli of the lung. So the basement membrane is the type 4 collagen. Then is the type 10. Type 10, it is found in hypertrophic cartilage. Hypertrophic cartilage is the type 10. Then is the type 17, that is found in hemidesmosome. Then is the type 19, it is found in rhabdomyosarcoma. It is associated with rhabdomyosarcoma. So there is just a small list that we have made. Although the list is very long, we do not have to remember all the collagen, various type 5, 6, 7 and so on. The first 4 are the important ones. Then if you want to remember, you can remember the 10, 17 and 19. 10 in the hypertrophic cartilage, 17 in the hemidesmosome and 19 is associated with rhabdomyosarcoma. These are the points to be remembered. Now, let's see how the collagen is synthesized. The collagen synthesis. Collagen synthesis. The cell which is responsible for the collagen synthesis is the fibroblast. The place is going to be fibroblast. And in the fibroblast, the organelle which is responsible for collagen synthesis is endoplasmic reticulum. So it is the endoplasmic reticulum of the fibroblast which is the initiating site of the collagen synthesis. So for better understanding, what I do is, if I make a fibroblast, say this is a fibroblast, here we are going to make the collagen inside the fibroblast. Now, till now, what we know about the collagen is that the collagen is a protein. Protein means what? A chain of amino acid, right? So now the question arises that in collagen, which type of protein we have? So in the collagen, we have basically 3 types of amino acid that we have. We are saying that collagen is a protein. proteins are made up of amino acids. So now the question arises that which amino acid are there. So when it comes to collagen, there are 3 amino acids which are there. The first one is glycine. The first one is glycine. The second one is I am writing as X, and the third one I am writing as Y. They may be different, but the every third amino acid is going to be glycine. So it will be like this: glycine X Y, again glycine X Y, glycine X Y, and so on. So we'll make a chain. We'll make a chain of amino acid, and every third amino acid is going to be glycine. The second and third may be different, but the every third is going to come is the glycine one. Glycine XY, glycine XY, glycine XY, and so on. Most of the time this X is replaced by proline. Not always, but most of the time, and this Y is replaced by lysine. So if I ask you that which is the most common amino acid, it is glycine. And if I ask you that which are the common amino acids that are found in collagen, then the 3 options will be there is glycine, proline, lysine. Glycine, proline, and lysine. These are the common amino acids that is there in the collagen. Now, so I can say that because these 3 amino acids is going to be repeated for multiple times, so I am writing glycine X, Y into N. They will be repeated for N number of times. So you will get a linear sequence of these amino acid, and this linear sequence of amino acid of glycine, proline, lysine repeats. This is referred as pre-pro collagen. This is referred as pre-pro collagen. Now this pre-pro collagen is not strong enough to make your bone, to make your muscle, ligament, tendon, right? It is just a chain of amino acid. It's not strong enough to make your bone. So we have to do a certain changes to make it strong enough that it can make your bone, it can make your muscle, can make your ligament, tendon, and so on. So what are the modifications that we are going to do so that it will convert into a strong, stable structure? See, right now the pre-pro collagen looks like this. It is having a helical structure, it is having an alpha helix structure. So what we do is we take 3 pre-pro collagen molecules, and we rotate these 3 pre-pro collagen molecules on one another. If we rotate 3 pre-pro collagen molecules on one another, the structure will look like this. This is called as triple helix formation. So the first modification that you have did inside the fibroblast is something called as triple helix formation. This is the first modification that we did, triple helix formation. Then the second modification that we do is, we add the glucose on the amino acid which are there in the collagen, right? And that is called as glycosylation. We are going to add the glucose molecule, that is called as glycosylation of the amino acid. Then the third thing that we are going to do is we are going to add the hydroxyl group. That is called as hydroxylation. Hydroxylation means we are going to add the OH group. Hydroxyl means the OH group. To do the hydroxylation, it requires vitamin C. If you want to do hydroxylation, it will require vitamin C. Now, when you do all these changes inside the fibroblast on a pre-pro collagen, you make the triple helix, you do the glycosylation, you do the hydroxylation. Ultimately, this pre-pro collagen will be somewhat more strong, and this pre-pro collagen will convert into a molecule that is referred as pro collagen. This is called as pro collagen. This is somewhat more strong than the pre-pro collagen, but it is still not strong enough to make your bones. So now this pro collagen is converted into pro collagen. Now this pro collagen will come in the extracellular environment. This pro collagen will come in the extracellular environment. This is the extracellular environment. So now we are going to do certain changes in the extracellular environment so that it will be more strong. So what we do is, to make it more strong, the first thing that we do is we cleave the terminal part, means we remove the terminal parts of the pro collagen. That is called as cleavage of the terminals. Cleavage of the terminals means whatever is the terminal part, we will remove them out. Now once you will do that, then we are going to do oxidation process, right, that is called as lysyl oxidase, is going to work on these pro-collagen molecule. So lysyl oxidase is going to come and going to work on the pro-collagen. This lysyl oxidase requires copper. For the functioning of lysyl oxidase, we require copper. Then the third thing that is going to happen on this pro-collagen molecule is something called as aldol condensation. So once we do all these changes in the extracellular environment, we remove the terminal part, we treat with the lysyl oxidase, then we do the aldol condensation. So we get a strong unit. We get a strong unit that is a quarter staggered unit that is called as tropocollagen. The molecule that we are going to get is something called as tropocollagen. Now this tropocollagen is a strong unit. Tropocollagen is like a brick. Now this is basically a structural and the functional unit of the collagen. Means you want to make different types of collagen. So what you do is you arrange the tropocollagen in different manner and you will get the different types of collagen. Right. So this tropocollagen is the main unit, is the main functional unit that is going to be there in all the types of collagen. You just arrange the tropocollagen in different manner and you will get the different types of collagen. So I can say tropocollagen is the structural and the functional unit of collagen. By tropocollagen, we will make the different types of collagen. The different types of collagen we are going to make from the tropocollagen. So this is how the collagen is synthesized. So what are the questions that they are going to ask you from the collagen synthesis part? First thing is, which is the most common amino acid? The most common amino acid is glycine. Every third amino acid is going to be glycine. Which are the three common amino acids that are there? Glycine, proline and lysine. Then they ask that what are the intracellular events and what are the extracellular events. The intracellular event, what we do is we make the triple helix, we do the glycosylation and the hydroxylation. Then the extracellular events is the lysyl oxidase, the cleavage of the terminal part and the aldol condensation. The molecule that we are going to get is the tropocollagen, and that tropocollagen is going to make the various types of collagen. So this is how the collagen is made, and this entire process is occurring in the fibroblast. In the fibroblast, where is mainly occurring in the endoplasmic reticulum. So this is how the collagen is synthesized, and these are the questions that they are going to ask, that which are the intracellular event and which are the extracellular event. Now, because it is a complex process and it requires a lot of enzyme in the collagen synthesis, sometimes what may happen is that there may be a deficiency of particular enzyme may occur, or maybe a particular gene defect may occur, so that a particular collagen will not be made properly. If a collagen is not made properly, then it will lead to certain disorders, and they are called as the collagen disorders. So let's write down the list of the collagen disorders. So starting with the first one, the first collagen disorder is if, let's say, the type 1 collagen is defective. Type 1 is found where? It is found in bone. If the type 1 is defective, it will lead to the bones will be defective. If type 1 is defective, means bones are defective, right? So it will lead to something called as osteogenesis imperfecta. It will lead to osteogenesis imperfecta. Osteo means bone, genesis means formation, imperfecta means imperfect. So the bone formation will be imperfect if the type 1 collagen is defective. If the type 1 is defective, it will lead to osteogenesis imperfecta. What are the points to be remembered for osteogenesis imperfecta is, if we talk about the clinical feature, these childs will have something called as blue sclera. Now what is the meaning of blue sclera? See, normally this white part of the eye is called as sclera. But in these patients of osteogenesis imperfecta, what happens is that the sclera is very thin. So behind the sclera, we have the veins which are there. And these veins are visible from the outside, right? Normally the veins which are there, the choroid plexus, which is there behind the sclera, it is not visible right now. In my eyes, it is not visible. But if the sclera is very thin, the white part of the eye is very thin, the choroid plexus reflex will come outside, and that reflection that you are going to see, it will give the bluish discoloration of the sclera, right? So if I show you the structure of the blue sclera, it will look like this. Now you can see in this diagram that this is the blue sclera, right? This is the blue sclera. There is blue discoloration of the sclera. Normally this part of the eye is white. It is clearly visible from outside is white, but because in this child the sclera got thin, so the choroid reflection, choroid plexus reflection is coming out and is going the blue discoloration, and that is called as blue sclera. So this is one of the features that we should know regarding the osteogenesis imperfecta, that is blue sclera. Now coming to the second disorder. The second disorder is if the type 2 is defective. Type 2 collagen is found in cartilage. Type 2 collagen is found in cartilage. If the type 2 is defective, it will lead to the cartilage will be defective, and that is called as chondrodysplasia. Chondro means cartilage. The cartilage are going to be defective, so that is called as chondrodysplasia. Chondrodysplasia. Then the next one is the type 3. If the type 3 is defective, it will lead to, see, type 3 is found in major blood vessels. Type 3 is found in major blood vessel. If it is defective, it will lead to something called as Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Now what is Ehlers-Danlos syndrome? See, in Ehlers-Danlos syndrome, almost all the type of collagen is defective. Almost all the types of collagen is defective, but if you have to select one, then you are going to select the type 3. So I am writing the statement that Ehlers-Danlos syndrome, almost all the types of collagen are defective. Almost all the type of collagen are defective. But if you have to select one, that which is the most specific, then you will see the type 3. But the most specific is type 3. Because rest can be defective in other disorders, but the type 3, if it is defective, then it is going towards the Ehlers-Danlos syndrome only. Now in Ehlers-Danlos, what happens is, as I am saying that almost all the collagens are defective, the person will have hyperelastic joints. The hyperelastic skin will be there, right? So he will be able to do, or he will be able to move the joints more than the normal range of the motion. So this Ehlers-Danlos syndrome is also referred as rubber man syndrome. Also called as rubber man syndrome. So if I show you the image of rubber man syndrome, this is the image of rubber man syndrome. This is the image of rubber. You can see that this normal, a normal healthy individual cannot do like this, right? This is the hyperelastic joints which are there. The range of the motion of the joints is increased, and this is seen with Ehlers-Danlos syndrome. If the type 4 collagen is defective, type 4 is found in the basement membrane. If the basement membrane is defective, it will lead to something called as Alport syndrome. It will lead to Alport syndrome. So type 4, if it is defective, it will lead to Alport syndrome. Alport syndrome, the classical triad of the clinical feature is important. It will lead to hematuria. It will lead to sensory neural hearing loss. And it will also lead to something called as anterior lenticonus. So the classical triad of the symptoms that you are going to see in a patient of Alport syndrome, the patient will have hematuria, the basement membrane is defective, will lead to hematuria. There will be hearing loss, and this is the sensory neural type of hearing loss. We have discussed one more condition where we have the sensory neural type of hearing loss, that was the Pendred syndrome. That was there, if you remember, along with the hypothyroidism, the iodine receptor, the pendrin was not working, right? So here also we are going to have the sensory neural hearing loss. Along with there will be lenticonus. Now what is lenticonus? See, normally if I just give you a simple diagrammatic representation, let's say this is the cross section of the eyeball, and this particular part is your cornea, right? There is a curvature of the cornea. We have the black part of the eye. This is the cornea, and that we have a curvature on that. Now, if there is excessive curvature, let's say the diagram looks like this. Now what you can appreciate is that the curvature of the cornea is increased excessively on the anterior side. This excessive curvature of the cornea on the anterior side is called as anterior lenticonus. So what is lenticonus is excessive curvature of cornea. This excessive curvature of the cornea is referred as the anterior lenticonus. So that is the Alport syndrome. That is the Alport syndrome. So we have discussed about the type 1 disorder, that will lead to osteogenesis imperfecta. Type 2, if it is defective, will lead to chondrodysplasia. If the type 3 is defective, it will lead to Ehlers-Danlos syndrome. The point to be remembered is in Ehlers-Danlos syndrome, almost all the collagens are defective. Almost all the collagens are defective. But the most important or the most specific one that is going to be there is the type 3. Then is the type 4. If it is defective, it will lead to Alport syndrome. The classical triad is very important. They will give you a clinical scenario and they will ask that what are the symptoms that are going to be there is the hematuria, sensorineural hearing loss, and the lenticonus is going to be there. So these are the collagen disorder. If the collagen synthesis is not proper, then the defective collagen will accumulate in a certain organ and will lead to the certain features that is called as the collagen disorders. Now, sometimes what happens is the collagens are made completely fine, but the immune systems are not working properly and they are making antibodies against a certain type of collagen. Right? If antibodies are made against a certain type of collagen, then that particular collagens are going to be, we can say, will not be working properly. They will be destroyed continuously by the immune system. And they are the autoimmune collagen disorders. So here I want to discuss the first disorder that I want to discuss here is with the name of good pasture syndrome. Good pasture syndrome. Now what is good pasture syndrome? Good pasture syndrome is there is autoantibodies. There is autoantibodies against the basement membrane. If we make the autoantibodies against basement membrane is primarily a two-part in the kidney and in the lungs, right? If there is autoantibody formed against basement membrane is the type 4 collagen. Collagen is completely fine. Type 4 collagen is completely fine, but the immune system is misdirected. So, how the patient will come to you is the clinical feature the patient is going to have is he will have hematuria because the basement membrane in the kidney is destroyed, as well as will have hemoptysis, means there will be blood in the sputum. Hematuria with hemoptysis, right? Blood in the sputum, that is blood in the cuff, that is hemoptysis, and the hematuria is going to be there. This is the first one, that is the good pasture syndrome. Then the second one is the something called as the bullovesical disorders. Bullovesical disorder. To understand the bullovesical disorder, first we need to understand a simple, we can say, histology details of the epidermis and the dermis. See, the epidermis is having 5 layers. Epidermis is having 5 layers. How we can remember is with the mnemonic college, CLG, college, bus, college, bus. These are the 5 layers. The lowermost is the stratum basale, and I am right now concerned with the stratum spinosum. That is the stratum granulosum, stratum lucidum, and stratum corneum. The stratum corneum is the uppermost, and the stratum basale is the lowermost in the epidermis. These are the layers which are there in the epidermis: stratum corneum, lucidum, granulosum, spinosum, and basale. Now, when it comes to the dermis, in the dermis we have 2 layers. One is called as the papillary layer and the reticular layer. Papillary layer and the reticular layer. So I can say that if this is the representation of the stratum basale, here is the papillary layer and here is the reticular layer. So the point I want to convey to you is that the space which is there between the epidermis and the dermis, there is a space between these two. This is the subepidermal area. Beneath the epidermis, subepidermal. So the stratum basale, or I can say the epidermis, is uniting with the dermis with the help of one structure, and that is the hemidesmosome. This yellow color structure which I am making, these are the hemidesmosomes. These are the hemidesmosomes which are joining the epidermis with the dermis. These are the hemidesmosome. Because we are discussing hemidesmosome, so here itself I want to add a related topic, that is desmosome. So in the stratum spinosum we have the cell linings. The cells of the stratum spinosum is held together with one another with the help of a structure, and that is called as desmosome. So now we have the orientation, that where is desmosome and where is hemidesmosome. Desmosome is there in the epidermis, right? It is in the stratum spinosum. The cells are joined by that. And whereas hemidesmosome, it is between the epidermis and the dermis. There is a link between that. That is the yellow color molecule in the diagram. That is the hemidesmosome. Now, once we have this orientation, now sometime what happens is that autoantibodies are formed against these molecules. So let's say there is autoantibody against hemidesmosome. If there is autoantibodies against hemidesmosome, this is referred as bullous. This is called as bullous pemphigoid. That is called as bullous pemphigoid. That is called as bullous pemphigoid. Whereas if there is autoantibodies against desmosome, this is called as pemphigus vulgaris. That is referred as pemphigus vulgaris. So depending that which structure is getting destroyed, if it is hemidesmosome, it's called as bullous pemphigoid. If it is the desmosome, that is called as pemphigus vulgaris, right? Now, what are the things that they ask in the exam regarding these two disorders, the bullous pemphigoid and the pemphigus vulgaris? What they ask is, where is the lesion on the biopsy? Where is the lesion? Where is the lesion on the biopsy? If you take the skin biopsy in the bullous pemphigoid, if I ask you the question that in bullous pemphigoid, the hemidesmosomes are getting destroyed. So looking at this diagram, if I say that the hemidesmosomes are going to be destroyed like this, the antibodies are going to be accumulated here, and this will be called as the bullous pemphigoid, BP, bullous pemphigoid. So where is the lesion? Subepidermal. Whereas in the pemphigus vulgaris, the desmosomes are going to be destroyed like this. This is the pemphigus vulgaris, PV. Where is the lesion? Inside the epidermis. So they ask that which is having intraepidermal and which is having subepidermal lesions on the biopsy. So the bullous pemphigoid, it is going to have the subepidermal, whereas the pemphigus is going to have the intraepidermal. In the pemphigus vulgaris, I want to add one more point, that in the pemphigus vulgaris, the acantholysis is seen in pemphigus, whereas in the bullous pemphigoid, there is no acantholysis. Acantholysis present, not present. See, what is acantholysis? Acantholysis means if the stratum spinosum cells, they are loosened apart. If the stratum spinosum cells, they loosen apart, that is called as acantholysis. Acanth word is used for stratum spinosum. Acanth word is used for what? It is used for the stratum spinosum. If there is lysis in the stratum spinosum, it is called as acantholysis. Acanth for spinosum. If there is lysis, it is called as acantholysis. So acantholysis is going to occur where? In the pemphigus vulgaris. Acantholysis is not a feature of bullous pemphigoid, right? So this is one thing that they ask. So these are the bullovesical disorders that we should know. When it comes to the autoimmune disorders of the collagen, we have discussed the Goodpasture syndrome. Then we have discussed about the bullovesical disorder. In the bullovesical, we have discussed about two, that is the bullous pemphigoid and the pemphigus vulgaris. So these are the points to be remembered when it comes to the autoimmune disorder of the collagen in the collagen. Now, the last collagen disorders that I want to add here is See, in the extracellular environment, I told you that when we are making the collagen, we use an enzyme that is called as lysyl oxidase. If I just scroll up the notes so that you will be able to correlate, this is the collagen synthesis pathway that we have used, and here we have used one enzyme that is with the name of lysyl oxidase. With the name of lysyl oxidase. If this lysyl oxidase is defective, right, that will lead to a disorder that is called as Menkes disease. That is called as Menkes disease. So let's write down this point. Defect of lysyl oxidase will lead to Menkes disease. Defect of lysyl oxidase leads to Menkes disease. Menkes disease. So these are the various collagen disorders. If the collagen itself is defective, if the enzyme is defective, or the autoimmune disorders are there, right? Thank you guys.